Now, on the day when you first saw him at 1 o'clock, will you tell us just what his condition was at that time? May I refer to the record? Surely, absolutely. Well, in the first place, he was conscious, and his complaints were of numbness of the right leg from the hip down, slight pain in the right groin, laceration of the face before the left eye, and bleeding gums. Do you want me to give the history or just tell what I found at that time? What you found at that time and what you diagnosed as his condition to be. Well, then I expect you ought to know the story as I got it. That is all right, sir. Just tell it in your own way. He told us he had spent the morning in the downtown area shopping. He was walking south on First Avenue when he suddenly fell, and he does not remember anything following that. He didn't remember anything for an hour later when he awakened in the admitting room of the city hospital. Did he give you any history of how he happened to fall? He did not. He didn't say he stumbled or stubbed his toe or anything of that sort? No, except the question of his having had pain previous for that had arisen, and he said he had had no pain previous to the fall, and he had no vertigo, he said, nor headache, nor nausea, nor a thoracic distress, that is, distress in the chest before the fall. He told us that he had none when he awakened, except a numbness of the right leg from the hip down. Patient mentally clear, respirations of 20, pulse 78, blood pressure 108/58. That is 108 systolic and 58 diastolic. Go ahead, doctor. Now, on examination, he was conscious, face somewhat cyanotic, particularly the lips blue, that means. There was a cut below the left eye which seemed to be superficial, and there was a subcutaneous purple discoloration about the left eye. The pupils reacted to light and accommodation, showing the reflexes equal on the two sides and normal. The eye grounds showed some sclerosis of the retinal vessels, no hemorrhages, and no swelling of the optic disc, showing that there wasn't a marked increase of cerebral pressure, that is, inside of the skull. There were two upper front teeth broken off, and the bridge work was loose, and there was bleeding of the gums. The nose was clear, the ears negative for any easily demonstrable pathology. The neck showed no swelling of the lymph nodes at the side, and there were no abnormal pulsations demonstrable on the first examination or noted at the first examination. Chest showed the lung findings within normal limits. The heart, left border, was increased a little farther from the midline than we look for it to be, but considering his age, it wouldn't attract much attention. The apex impulse was palpated and was out a little farther than we expected it to be. The right border of the heart was normal, and the heart sounds revealed a blowing systolic murmur, with the first sound. The abdomen showed no tenderness or abnormal rigidity. No abnormal rigidity, is that what you said, doctor? That is right. The liver margin was at the normal level, and the spleen was not palpable. There was a slight tenderness in the right flank. Now, an examination of the extremities, there was pallor of the both legs. The right was more white than the left. Pulsation in the artery on the back of the foot, that is, on the top of the foot, was not demonstrable, nor was it demonstrable in the popliteal nor the femoral on the right side, and there was good pulsation in the vessels of the left side. The reflexes seemed a little delayed on the right side. Now, in the afternoon, the blood pressure became 156 systolic and 85 diastolic. Both the diastolic and a systolic murmur soft blowing murmur was heard under the upper sternum. Patient became more restless and cyanotic, and the pulse rate increased to 100. Before you get to that, doctor, at 1 o'clock you saw him, did you? What did you diagnose his condition at that time to be? Not conclusively. Not conclusively, but whatever opinion you had at that time, what was it? My opinion was that the right femoral artery had been closed, and the thing that most frequently closed those so that you get no pulsation in so large a vessel is an embolus. This embolus, doctor, is caused by leakage of blood, is it? No, it is caused by some solid particle getting into the bloodstream somewhere, usually a clue or clot in the heart itself or in one of the lung vessels. Then it goes through the heart and slides out into the vessels and gets into one of those, most frequently from a thrombus of a clot formed in the heart itself. A clot is a clot of blood? That is right. Well, could there have been a break in a vessel somewhere? Yes, that is possible. The blood pressure went up as I get it? That is right. What did that indicate, if anything? Well, it meant that he was in shock when he came in. He complained of substernal pain extending into the neck, aggravated by swallowing and taking a deep breath, and the pain also extended through to the back of the chest and down into the abdomen. Did you make any or come to any more firm opinion in the afternoon when you saw him? Yes. Then the question of the dissecting aneurysm arose. It did? Yes. Good.